our experiences and perspectives. So, experiencing war and living in displacement has taught me many things. But one of them is that taking care of your mind is just as important as taking care of your body. And that's why I believe it's especially important to send the support and give the proper MHPSS to people living in region of war, conflicts, so that they get the support they need to be able to rebuild their societies. Mental health and psychosocial support saves lives. It is a human right. But in some places, it's still seen as a luxury only available to rich and privileged people. We're here today to contribute to changing all of that and create a world where mental health and psychosocial support is truly a human right, no matter where you live and no matter what culture you belong to. On today's panel, we will talk about the impact of MHPSS by local actors and communities, and also build a bridge to global approaches and tools. We hope to inspire you to work to ensure that MHPSS is a part of all humanitarian and crisis response, because that will impact the well-being and recovery of people and communities in crisis. Our session is being put into pictures by our amazing graphic recorder, Sophie Lang, who will say a few words herself now. Thank you, Sophie. I look forward to seeing it at the end of the session. In a little bit, we will hear more about the importance of MHPSS in local programming across different settings. But first, we will discuss how global approaches and tools can be used to create better MHPSS programs on the local level. I'm very pleased to introduce Mariette Schuurman, who is the Director of Stabilization and Humanitarian Aid at the Ministry of the Foreign Affairs of the Netherlands. Mariette has a speaking at the IHL session for which she needs to leave in about 20 minutes. We will also meet Yusuf Abba Tijani, who is joining us by video. And Yusuf is the director of the Grow Strong Foundation in Nigeria. And from Colombia, we have a video from the National Health Technical Coordinator of the Colombia Red Cross, Joyce Yalene Cayabero Bernal. So Mariette, the Dutch Ministry of Foreign Affairs has been leading on MHPSS in crisis situations since 2019, when you organized the second Global Mental Health Summit. Can you explain the role of donors in facilitating the integration of MHPSS across the humanitarian development peace nexus? Thank you.
Thank you, Rosie, and thank you for allowing me the opportunity to speak. And again, apologies, I have to leave early to speak somewhere else on IHL, which is, I think, also linked to this subject. But I think I really would have liked to stay throughout the session because, as Elke rightfully said, since 2019 and the Mind to Mind Now conference in Amsterdam, a lot has happened. 2019 was an important year. So we had indeed the Mind to Mind Now conference in Amsterdam, where basically the international community recognized that mental health and psychosocial support has to be integrated from the very start in all crisis response, not only humanitarian, but all crisis response, from conflict prevention, conflict resolution, early recovery, and humanitarian assistance. In 2019 as well, we had a global refugee forum where the importance of mental health and psychosocial support was recognized as a key component of any response to protected displacement. In 2019, we also had the 33rd Red Cross Red Crescent Society conference that adopted a resolution unanimously, or at least adopted by all state parties, on the importance of integrating mental health and psychosocial support to all crisis response. And then since 2019, we unfortunately had many, I think, crises that underscored the importance of mental health and psychosocial security, to integrate that from the very start. We had obviously COVID, and we saw across the world what it did, particularly to our young people, to be confronted with a crisis, with a lockdown, with isolation, with being disrooted. So the mental health and psychosocial support, mental health needs basically skyrocketed. And then we also had other crises, nature-made or man-made. We have the war in Ukraine. We had now the earthquake in Turkey and Syria, where we actually saw that crisis on crisis, what it does to people and their resilience, and the importance of responding to that. I think on a positive note, we also have learned that for now it is largely recognized that mental health psychosocial support needs to be integrated in all response from the very start. And a lot has been invested also, for instance, by UNHCR and the Executive Committee last year, in their conclusions of the importance of integrating mental health psychosocial support across the board for displaced people, but also for responders, for your own staff, the duty of care, for people to be able to continue to do the important work that they do, to also look at the quality of the response. And so I think all that just highlights the importance that we now recognize the importance of mental health psychosocial support, but with that awareness also comes the awareness that we need to invest much more in capacity and in tools to provide people with what we need to respond to these enormous needs. So in terms of capacity, we have been working on, for instance, in the MENA region, on a diploma course for mental health and psychosocial support, together with CARE, Save the Children, ILO, and UNHCR. We've been working as a Team Europe with ECHO and Germany on developing trainings for policy officers and decision making in the MENA region again, in order to integrate mental health and psychosocial support in the responses. And we are supporting, and this is my first ask everybody, actually to all the donors, we're supporting a mental health psychosocial support search mechanism, so a rapid response mechanism. And we would really invite others to join us and support this mechanism financially and in terms of knowledge, so that we can respond much better in emergencies. So one thing is capacity, and the second thing is tools. So we have been working on the mental health psychosocial support minimum service packages, which was adopted by the IASC. So that's now an IASC instrument. And that helps basically to integrate, make policy officers integrate mental health psychosocial support in the planning and financing of emergency responses. But it's also a great tool to explain actually why mental health psychosocial support matters in the response. And we're now starting a second stage, and this is my second ask to the donors here, is to support, like the Netherlands, the second stage of the development of this minimum service standards, which will now also work both on training tools as well as on joint needs assessments. So, as I said, a lot has been invested in terms of enhancing the capacities, in terms of training, in terms of developing tools, but much more needs to be done, and we need all you to come on board to make sure that we can face the increased awareness, but particularly also the increased needs across the world for mental health and psychosocial support. And maybe I would like to finish this with quoting Mark Lowcock in the Mind to Mind conference in Amsterdam, who said that the single most important factor that decides people's survival in times of crisis is their mental strength. And that is what this is all about.
Thank you, Mariette, indeed. Now moving on to another perspective, the IASC Minimum Service Package is an important tool with a set of MHPSS activities that should be prioritized in all humanitarian responses. It is an interagency product that has been developed over the last 3 years, and it was piloted in 2021-2022. The Grow Strong Foundation was one of the NGOs involved in piloting the MSP in Nigeria. We asked Yusuf Abba Tijane, the director of Grow Strong Foundation, to tell us a little bit more about how they used the MSP and how it helped them to strengthen their work. You'll be able to see it in a minute.
Thank you very much for the introduction as well as opportunity to present our field-level experience with regard to the piloting of the MHPSS service package. Granted, we pilot the program for almost 18 months with the support of UNICEF field office here in Maiduguri. Through regular consultation as well as guidance, we are able to pilot the program across two field locations, one in IDP and then the other in internal display camp, as well as the other in the host community. Before the NHPSS minimum service package, most of our implementation was not very unique, was not as very strategic as possible. But immediately after we come across the tool in this minimum service package, we find out like our program is very much aligned with what was really required in the field. The minimum package really helped us to strengthen our MHPSS program, specifically looking at the capacity building of field volunteers, development of MHPSS messages, as well as how we can easily penetrate into community through this guidance of this tool. One of the best aspects of the tool is the MIE monitoring and evaluation of program activities, where for the first time we are able to evaluate the impact of MHPSS. That is to say that not just to measure an indicator, but this time around we even measure the impact with the help of the with tools such as the Wow Week as well as other tools through the guidance of the global team. In as much as the minimum package grows strong is able to use it and has achieved as has strengthened its own system, we would also like to see that other partners have adopted. This is to ensure that the uniqueness of working by all partners, or either humanitarian or development, to ensure that all partners adopt this minimum service package, including donors, integrated into our program strategy. Then this will give us a very unique way of intervening in MHPSS programming. So I think there is need for more partners to come on board and start using this minimum service package. So the best way to reach out to the partner, I believe we can do that through the cluster system, and then more national NGOs especially should be supported and should be encouraged to use the minimum service package, because I believe that with this minimum service package, more intervention and more successes with regard to MHPSS will easily be achieved. Thank you very much for UNICEF Maiduguri Field Office for all the support, as well as the global team for their technical guidance during our implementation period here in Northeast Nigeria. Thank you all, and I wish you all a successful deliberation.
So that was an interesting insight. Now I'll invite our panelists to sit back. Take your time. So, moving on. In 2019, the Red Cross Red Crescent movement adopted a global policy addressing MHPSS needs. A roadmap was also developed to support the implementation of the ambitions in this policy. One of the countries working to implement the policy is Colombia. We will hear now from Joyce, who will explain how they have seen this being translated on the national level in Colombia over the years.
a socializarnos a nosotros como sociedad nacional, la política de movimiento de salud mental, ¿cierto? La revisamos con el equipo técnico que tenemos acá en sede nacional, en el equipo de gestión integral de salud. La revisamos y nos dimos cuenta que veníamos haciendo algunas clases de ejercicios y actividades no denominadas como se encuentra en la pirámide de intervención, pero sí las veníamos realizando anteriormente. Tuvimos la oportunidad también de poder retroalimentar esa política antes de que fuera adoptada o acogida, que también nos permitió darnos un panorama. Durante la lectura, durante la revisión de esta política para poderla bajar a nuestros referentes de salud mental y apoyo psicosocial de nuestra sociedad nacional, nos dimos cuenta que esas actividades que veníamos haciendo no estaban fuera del contexto de lo que se plasma ni tanto en la ruta ni como en la política, y hay un ejercicio de la coordinación del programa SMAPS de la sociedad, de mirar cómo agrupábamos todas esas actividades y hasta dónde nuestra sociedad nacional podría llegar a hacer ese acompañamiento y esa atención en salud mental a nuestros beneficiarios, que pues son las comunidades, sin dejar a un lado también nuestro personal de la sociedad nacional como voluntarios y colaboradores y empleados. Posterior de haber hecho ese análisis, nos dedicamos a contarles, ¿cierto?, a sensibilizar a nuestros equipos, a nuestros referentes de salud mental de la sociedad nacional. En este momento pues tenemos 23 referentes, 23 grupos que abarca aproximadamente 252 voluntarios que tienen la especialidad de SMAPS y que nos apoyan en este ejercicio. Su adopción fue fácil, por lo mismo que mencionaba hace un rato, que pues no estábamos como muy lejanos de lo que marca la política, sino que íbamos por buen camino, y cómo nosotros podemos llegar a hacer ese ejercicio enmarcado en la política, en la ruta, para que nuestros beneficiarios tengan una mejor calidad de vida, ¿sí? Hoy día en Colombia el tema de salud mental hasta ahora está despertando ese interés. Gracias a la pandemia, eso lo podemos decir, gracias a la pandemia y a todo eso que dejó, ¿cierto? Que ha venido dejando también la pospandemia y cómo articularnos para hacer esas actividades y dar cumplimiento a esta ruta de atención sobre todo, ¿sí? La sociedad nacional, hemos tratado de llegar hasta la punta de esa pirámide, que es lo especializado, pero sí se nos dificulta un poco porque nosotros no tenemos el habilitado, por ejemplo, el servicio, y de acuerdo a nuestra normatividad colombiana debe estar, ¿cierto? Hablo de un tema, por ejemplo, una especialidad de psiquiatría. Pero nosotros, ¿cómo hacemos? Nosotros hacemos a que por intermedio de nuestras instituciones prestadoras de servicio de salud que se encuentran en las filiales, como si tienen habilitado ese servicio, cómo puede acceder a ese. Y si no, enrutamos, ¿sí? Y ya sería una respuesta del Estado, pues que poco a poco la ha podido venir desarrollando o dando a la población en Colombia. Entonces fue un ejercicio interesante. Nos sentimos muy satisfechos en el sentido de que no, como mencionaba, no estábamos como desligados, ¿cierto? Íbamos por buen camino y nos ayudó a fortalecer. De ahí se desprende un poco el ejercicio de tener unas mesas técnicas también, ¿sí? Por cada nivel de la pirámide, y poder sensibilizar al voluntario hacia dónde quiere encaminarse para realizar estas atenciones. Porque pues les recuerdo que en la sociedad nacional el que está en los grupos de salud mental y apoyo psicosocial es un voluntario que no necesariamente es profesional de la psicología, ¿cierto? Sino que hacemos el ejercicio de formarlo y él también puede hacer una atención a primer o a segundo nivel de acuerdo a la pirámide. Ese es nuestro ejercicio hasta el momento, adoptada en 23 seccionales hasta el momento y siguiendo la octava. Y no solo en el tema de las seccionales, sino en los temas de los proyectos, ¿sí? Nuestra área de salud, la mayoría son acciones basadas en proyectos por socios cooperantes y socios donantes y demás, que nos permite también dar cumplimiento a esa política, ¿sí? Entonces no va desligado lo uno con lo otro. La política es nuestra base, nuestra normatividad para nuestra sociedad nacional, para el programa, sin dejar a un lado la normatividad colombiana, y cómo agrupamos acciones comunitarias realizadas por nuestros grupos SMAPs y acciones realizadas en los marcos de los diferentes proyectos.
Thank you so much for these interesting perspectives. I'm sure that there are many questions now from the audience, and I do think that we have time for one or two of them.
I work at Interpeace. Sorry, I'll stand up. My name is Anne McDulse. I work at Interpeace, Strategic Partnerships Unit. And Mariet Schumann just said that it's key for people's survivals to have a strong mental health. And Interpeace is an organization, among many others, that works towards an integrative approach for MHPSS and peace building, and will soon launch its guidelines to be able to do so. And my question is, how can MHPSS be more structurally integrated into peace building initiatives? Thank you.
So I'm a colleague of Mariet Schuurman who had to step out. I think it's a very important question, and it's not only about integration of MHPSS and peace building efforts, it's also about the structural recognition of psychosocial dynamics in conflict analysis. And if a conflict analysis doesn't start with that, you may miss out on the core of what you're trying to do. So among others with Interpeace, but also with a number of other partners, we're really trying, and together with Germany and others, we're trying to, first of all, increase that recognition among those that design the mandates, the programs, the budgets, the commissions, for actors in the field, in order for actors in the field to get the space, budgetary space, but also policy space and staff space, to get the space to actually include MHPSS in their work. One last thing I would like to say is that the integration of MHPSS and peace building should be in two directions. The two professional communities should really make use of each other's, could better make use of each other's expertise, knowledge, tools and guidelines, where and if appropriate, always context adapted to the context. And I think a lot of progress has been made over the past 2 years in developing tools and recommendations in this field. But maybe you would like to, no?
Thank you. Do we have any other question? Coming.
Thank you so much. I'm from Colombia, so I related with the information that the person who was in the video said. I'm a psychologist, and I lead an NGO that is an expert in related with MHPSS. And we work with victims of sexual violence in the armed conflict and victims related with migration. That is another situation of emergency there. But something that we see there is in general, the capacity of the government for giving support of mental health is almost nothing. Even when it's in the laws, the possibility is not real there. And sometimes what we see is like the people could have an access from not specialized psychosocial support, and even when they need it. And then sometimes what we see is they don't have access to any other situation. And something that we see in the emergency context is the people who knows about psychosocial support is not related sometimes with information with gender-based violence. And the people who attend the gender-based violence don't have the information and don't have sometimes the skills and the information for giving a real good psychosocial support. Not only the first aid that maybe is easy to have, the company in the process, But in general, the people who suffered sexual violence in Colombia, who have been in a very bad context of sexual violence with a lot of offenders at the same time and other situations and exploitation, trafficking, trade, and a lot of these things, well, they don't have the need covered by the help that we did. How you could imagine that is possible in this kind of context that is shared for other countries, sadly, what it could be a good way to connect these guidelines that the EASC have for the mental health support and the EASC have for another, in another side for gender-based violence. How do you imagine that it could be possible?
I can try to answer perhaps from the German perspective, because this is something since the beginning of our discussion, I thought I should say here. In the morning, in the auditorium, you surely listened to what all the representatives said. They all talked about humanitarian development peace nexus. And MHPSS, mental health, is inside of this HDP nexus. And as a development person in the German ministry, working but with transitional aid, I can state here, this is not an issue you can solve in 1 or 2 years. So we have to take in serious this nexus. It takes time. It is multi-sectoral, as you said. It's not only about violence because of a war in Colombia. It's because of sexual violence. So you will need time, and it's multi-sectoral. It's economic, it's social, it's mental health. And I think this is very important when we talk here, and Mariette already said it. We started in 2019 when a lot of people didn't even know mental health. Why do they come with mental health right now? Especially in the humanitarian sector, I would say. I'm a developer person, but it was not discussed. So now, 4 years later, I think, we are discussing it, which is wonderful. And we're getting questions as you made your question. How can you connect all this? How can you get the government on board? And this will only work out if humanitarians and development people work together over years in a very structural way, and if they do not leave the P for peace, because this is also, I think it's great that from Colombia you stated this question, that we do not leave the P outside, because in Colombia you have a peace agreement, and without mental health, without less violence, being it sexual violence at home, being it sexual violence because of the war, you will not go further with your peace agreement. So I just wanted to make a strong statement for the nexus, and ask you all, please, wherever you discuss, talk about it's a multi-sectoral challenge, it's a long-term challenge. You can act shortly and from the beginning on. And here, Rosie, you are here. This is great. Yep. Because of an emergency situation, you came here. But now you are here and you are the moderator. This took 10 years from there to here. Yep. So this is the message I want to state here. Let us work together, but this will not be solved in 2 years. We all have to partner, the humanitarians, the developers, and the peace specialists, and afterwards I will have a little input. I can talk about our tools, but this is so important that we explain this to everybody, especially to the politicians. And as I come from a government, I ask you to support me.
Yes, sorry for interrupting, but we have...
sorry.
Yep, sorry. I encourage you to ask and find the panelists after our session to ask your questions and get the answers in details. Okay, so moving on. We've heard about global perspectives and how they can be translated to local levels. We will now discuss 2 case examples of complex and forgotten crises. They will highlight the needs and importance of integrating MHPSS across sectors whilst taking a whole society approach. In this part, we're joined by Ruma Kondakar, who is the MHPSS Technical Advisor for Save the Children Bangladesh, and also the director of the Iraqi Alliance of Disability Organizations, Hashim Al-Azawi. And finally, El Kalubal, who is the Commissioner for Refugee Policy at the German Ministry for Economic Cooperation and Development. So, Ruma, thank you for joining us from Bangladesh.
Yes.
You work in Cox's Bazar,
Yes.
where access is rather challenging and the needs of the displaced and host population are increasing day by day.
Yeah.
Can you share how the integration of MHPSS is key to improving outcomes across sectors and contexts despite these challenges?
Okay. So I would like to everybody to take a breath because it's a story of a boy, 8 years old. His name is Ador, and it's pseudonym obviously, and the meaning of this name is lovely boy. So when our we have a public health center, like primary health care center, and one day a boy who's running around the health center and looking for foods. So that's the initial identification of this boy. And later on, through child protection team, Save the Children MSPSS officer, she actually enrolled this boy and start to work. And later on, the finding is the boy who actually, his father died before his birth, as well as his mother died immediate after his birth, like 3 days after. So he lost his father and mother before he, realizes father and mother who is there. Then, when his age 5 days, then a foster mother actually received him and living with them with another 3 siblings. And the lady, she was widow that time. And the influx happened in August 2017, and they came from Myanmar to Bangladesh. And after that, the mother, new mother, foster mother, she married another person, and the father, new father, he's not actually well accepted this boy. It was extremely violated, physically beaten, and so many other violence happened. That's why the mother actually gave his child to her mother, like grandmother. Now is responsible as his caregiver when his age was 2.5 years, 2.5 years. After that, actually he was not that much connected or bonded with his primary caregiver. That's why what actually the history came up, he was with some attention deficit symptom, hyperactivity, and people are beating him usually because he was stolen something, lies every time, and he was not living at his house. So that's why his grandmother actually not able to taking care of him. So our MSPSS officer and MSGAP trained doctor, they actually sit with him and provide many sessions. And after that, it was found that he needs some peer group, friends. That's why they sent to child-friendly space, which is conducted by child protection team. It's another sector. Then also, he needs some nutritious food because he lost his appetite. He's not taking care of himself. So that's why he was not it's not like another average boys around him. So that's why he was lonely. Nobody actually loved him, and he was not realized that time he is able to take love from others. So that kind of condition actually identified by MSPSS team. Also they sent to nutrition team, it's another sector. Also they coordinate with site management team about his security because he's moving around many places. As well as he was also taking care of some other educational activities. As part of their activities, they engaged and sent to him learning centers. So that way, he is now progressing, little bit calm, and little bit can realize he can also write to love from others, from his foster family, from his community. So that way, he is now grew up with MSPSS team.
I'll ask you to wrap up. Sorry for interrupting.
So the thing is, so many challenges in Rohingya response. Actually, the resource gap, also the Nexus program, it's really recommended. Why? Because social cohesion, it's need to more work on that. as well as I can share with some needs with collaboration, coordination, as well as what mentioned before, the structured like a scope of integration, skill training, trained professionals need to be there. And also the understanding on MSPSS is really a huge gap. So we need to continue our service. And I think it's a donor and also many organization representation here. So it's really necessary. And it's clearly, present the need of MSPSS there with across the sector. Thanks for listening.
Thank you so much for sharing that touching story with us and also your inputs. Now moving on to the next perspective. In conflicts and crises, people living with disabilities and mental health problems often have serious problems accessing both the basic and more specialized services they need. AYADO is dedicated to promote the rights and access for people with disabilities. What are your most important priorities, Hashim, and how can international organizations best support this population?
شكرا روزا. أنا هاشم العزاوي مدير التنفيذي تجمع المعوقين في العراق.
Thank you, Rosa. My name is Hashim Azawi, the Executive Director of Iraqi Alliance for Disability.
حقيقة مشاركتنا هذه جاءت بصمة كبيرة ونقدرها ونثمنها اتجاه القائمين في المؤتمر، ونتمنى أن تكون أحد مخرجاته هو دعم للأشخاص ذوي الإعاقة في العالم والعراق خاصة.
So we are pleased to actively participate in this great conference, which we hope will support disability issues as one of its outputs.
قبل ما أتكلم ماذا فعلنا، بس أريد أبين بأن الشعب العراقي تعرض إلى كثير من الحروب كما يحصل حاليا في المنطقة العربية، مما أدى إلى الضغوط النفسية والجسدية. لذلك زادت الإعاقة في العراق أكثر من 4 ملايين شخص من ذوي الإعاقة، اللي هو نفس العراق هو 40 مليون.
So I would like to mention that in Iraq we are faced many challenges, many crises, like the wars and what remaining by the wars. This about many millions, approximate 4 millions citizens with persons with disability.
بالنسبة للإعاقات النفسية والذهنية والعقلية زادت إلى 34% أو أكثر حاليا. تحتاج إلى كثير من الدعم والبرامج اللي ممكن أن يستطيعون هؤلاء الفئة من الشعب العراقي إلى بناء قدراتهم واحتياجاتهم واعتمادهم الذاتي.
So they are the most affected by these difficult circumstances, and especially people with disabilities, mental and intellectual disabilities. They are represent about 34% from the number of the total persons with disability in Iraq.
لذلك أيادو أصبح على عاتقها أن تعمل بكل جدية حول تعديل التشريعات الوطنية الخاصة في الأهلية القانونية وكثير من الحقوق اللي تمكن الأشخاص ذوي الإعاقة.
So the main mission for IADO is it is carried out by the Iraqi Alliance of Disability is the work to amend the national legislation that violate the rights of people with disabilities in accordance with the CRPD, the Convention Right for Persons with Disability.
وكذلك القيام بعمليات بحملات توعية لتكثيف دمج الأشخاص ذوي الإعاقة والحد من الصورة النمطية اللي تواجه الأشخاص ذوي الإعاقة وبصمة العار اللي دائما يتكلم المجتمع لا يرحم للأشخاص ذوي الإعاقة عموما يعني.
Also, IADO led many national campaigns to raise the awareness how to deal with the disability issues and remove the negative stigma from the communities with the person with disability.
ولدينا الكثير من التعاون مع المنظمات الدولية منها سيف تشيلدرن وكثير من المنظمات الأخرى الداعمة في مجال التعليم والعمل والتأهيل. كل هذه تؤدي إلى تمكين الأشخاص ذوي الإعاقة.
So yeah, we have cooperated good relations with international organizations like Save the Children and others to support the inclusive education, rehabilitations, labor, job opportunity. That's to support the person with disability in Iraq.
لذلك نتأمل بأن تكون أحد يعني من مخرجات هذا المؤتمر الكبير بأن يكون هناك دعم حول تفعيل برنامج ومساندة الأيادو والمنظمات المجتمع المدني الأخرى على تفعيل برنامج التهيئ المجتمعي CPR.
So one of our expectation from the outcome from this important conference is how to support the IADO or the other organization deal with the regarding interesting with the disability issues.
لغرض تمكينهم حول التعليم والعمل والتأهيل النفسي، خاصة احنا برامج التأهيل النفسي والدعم الاجتماعي جدا ضعيف في العراق. نأمل من المنظمات الدولية أن تنهض بهذه البرامج.
So to
Sorry to interrupt. You just need to wrap up because we need to keep the time schedule. Sorry for that.
okay, we have 1 minute or
30 seconds?
so be more generous.
I just have to keep the timetable. Sorry.
Okay, تمام.
Give us more 10 minutes, no? Yeah, thank you. Okay, yes. Yeah, to.
Okay.
Thank you. Merci.
Thank you too much.
There you go.
So to for more let them more empowerment in different ways, like education, as we mentioned, to let them full integrating in the communities and focusing on community-based CBR, community-based rehabilitations. Yes.
حقيقة أنا مسوي يعني ورقة، لكن أنا خرجت عن إطار الورقة اللي لأن حجم المشكلة كلش كبير. فجوة التمكين الأشخاص ذوي الإعاقة بحاجة ليس فقط في العراق، بحاجة إلى كل العالم، محتاج إلى دعم ومؤاصرة ومساندة الأشخاص ذوي الإعاقة. هناك أكثر من مليار شخص من ذوي الإعاقة يحتاجون إلى الرعاية، يحتاجون إلى التأهيل، يحتاجون إلى الدعم النفسي والاجتماعي واحتوائهم وتقبل المجتمع للأشخاص ذوي الإعاقة.
So as we spend too much time to prepare this paper, but it seems we don't need to look for this paper because the speech is already running without need to read. As we cooperate with Luis for many meetings before coming here to us to Brussels, so the disability issues is over the world. It's big issues that need all the human efforts to join together because we face about 1 billion different type of disability over the world.
احنا عملنا النقطة الأخيرة، احنا عملنا كثير من التقارير لتحديد الفجوة حالنا بقية العالم، لكن هذا أملنا في هذا المؤتمر النهوض بواقع الإعاقة.
We are as IADO, we prepare many international reports and we discuss it with the UNCRPD in Geneva and the CEDAW committee and with the SDG committee to focusing on the big size of the problems and what the obstacles face the person with disability in Iraq, and we look forward for more support to pass these obstacles. Thank you, merci beaucoup, muchas gracias.
Thank you.